Um, oh, thank you, Amy. So for those of you, obviously there was many of you who were not here at our last meeting. At our last meeting, I took a step of faith, stepped out in courage, and asked if it would be okay if we start opening our meetings with prayer. And I'm so excited. It was practically unanimous. There was only one no. So I'm just so thankful that everybody was open to the idea of doing that. And so what we're going to start doing is just opening our meetings in prayer. And bear with me because I'm super nervous about it because I was like, what did I get myself into? But no, I just think that it's going to be powerful because we cannot always walk in our own strength. And no matter what your religion or faith is, I think that as a country and as a consensus, most people do believe that there is some sort of higher power. So that's who I'm going to be praying to today as my Lord and Savior. Okay, dear Heavenly Father, Lord, I just thank you for this group that you have established, Lord. We are here to serve and love on our community. And I just want to thank you that you opened the hearts and the minds of our group and they said yes to bringing you into our situation and bringing you into our mission, Father. And Lord, I just want to pray over our group and ask that you would strengthen them and that they would not grow weary in doing good. It's really hard work that we all do, Father, and there's days where we're discouraged and it's really hard. And so, Lord, I just pray that you would strengthen us. And I ask for favor over our group, that our mission and our vision would be accomplished in our community, and many would know about all the services that we're here to provide them. I pray these things in your Son, Jesus' name. Amen. All right. So our vision and mission as Oaks is to be a networking group where we can all come together and learn so much about all of the wonderful services that we all provide. I was just speaking to Nav. Uh, yes, Nav, right? I said it right. Yeah. This morning, and she was just sharing with me that since she started joining us for the last year and a half, she's just learned so much incredible information, and every time takes it back to her community and her networking group. And so I just love hearing that feedback and those stories of all that we're accomplishing as a group, whether it's in the community, that growth and that information is happening in our greater circle of contacts. So that is our mission and our vision, is to be a networking group and a group that serves the older adults in our community. And I mean, I put it on my notes this morning that I'd love to see us outgrow this room. And my word, we are we are looking like we're starting to burst at the seams. So maybe that's in our future, that we have to find a new location. There are flyers on the table for next month's meeting, so make sure to take those back to your respective communities and continue to get the word out. We love the idea of the general public attending our meetings, and so we're so excited to hopefully see that happen. Our vision is to create a unified senior resource team to support each other and the community that we serve, and our values are integrity, synergy, service, and collaboration. We have a QR code on that Oaks poster in the entry as you're walking in that you can scan and easily get connected to us on Facebook and Instagram. And if anybody forgot to put their business cards in our basket right here, we have some really amazing raffle prizes today. So I'm so excited to be handing those out after our meeting. Is anybody here new today? There has to be some new people because yes, one, oh yes, yes. Wonderful. So exciting to see these new faces. So everybody make sure to go introduce yourself to them after the meeting so that they can learn more about our group and feel that warm welcome. Anybody here have any announcements that they want to share with the group? If you're a yeller, just yell. If you need the microphone, yes, come on. Wonderful. Thank you. Any other announcements? Don't be shy. Yes. Okay. Wonderful. Thank you. Any other announcements? No, we're all good. All right. Liz Reese, is she here today? I don't think I see her. Liz Reese is our social media manager. So make sure to get her all of the information. If you want anything posted on social media, she is more than happy to post that for you. We are up 6 whole people. Hey, it's baby steps, right? One of the philosophies that I try to live by is be a turtle, right? Slow and steady wins the race, right? And our Instagram account is up 20 followers last month. So growing in that area as well. So just to continue to share and invite and let people know about us, our goal, we're at 485 on Facebook. So our goal is 600 by 2025. All right. Okay. Last announcement before we introduce our wonderful speaker today is our 2025 calendar is officially full. Woohoo! That's so exciting. And like I was telling Nav, we just so appreciate every time somebody, raises their hand to, present because it's not easy to be up here in front of people. So we really appreciate all of you, taking that opportunity to sign up. So without further ado, we will introduce our presenter today, Nav. She is a nurse with over 10 years of diverse experience, ranging from community and triage nursing to hospital bedside care. She has witnessed the vital role of keeping seniors safe and supported at home, educating families on senior care, advocating when needed, and fostering collaboration to prevent overwhelming our medical system. Today, she'll be talking to us about the Medicare's Guide Dementia Care Model, patient benefits, and how you can participate. So let's give her a warm welcome.
I think so. Yeah. I think I'm just. I think so. We'll try. Uh, Good morning, everyone. Thank you. Thank you so much for being here. I I was expecting people to attend today, but what caught me by surprise was the faces walking through the door and they're like, "We're here for you, Nav. Thank you so much. I don't want to cry, but it means a lot. It means so much. This is what I wanted when I started doing this. Almost like maybe less than like 2 years ago. This is exactly what I wanted to. I wanted to be part of a community and do this all together. So today I'm here to talk a little bit about ComeForCare and the program guide, which is Medicare's guide program. But before I also get into it, thank you so much for everyone at OACS Community Hospice for hosting this every single month. It is a lot of hard work, consistently showing up, and I have already shared with you guys. I learn every single time I'm here. So thank you so much. We appreciate you guys. And thank you for this opportunity today. So. ComeForCare and home care, we provide caregiving services to seniors and those who need in comfort of their home. The hours that we provide caregiving services are flexible. It can be few hours a day, week to 24/7 care. So I do want to add a point to this. In our office, when a phone call comes through to us, we work so hard to make sure that that client, that family's needs are met. Everything we do from that first phone call is client focused. It's what their needs are. I take the first initial meetings. I am very involved up until we have reached like a rhythm with every family. And we we come up with creative hours. We come up with creative care plans. It's all about how we can help them. So we are very reasonable with our pricing, our hours, our minimums, and all that. If you guys have any questions about that, feel free to reach out to me. I'm more than willing to speak to you one-on-one. There is no one answer because we all know no two clients are same. The needs are not the same. Everybody works in a different way. So in saying that, it brings me to my topic. We are a veteran provider and we do work with long-term insurances. Other than that, most of the services that agencies like us provide are private pay. And it brings me to our topic today, Medicare's guide program. So most of the clients that we serve, they have cognitive issues, dementia. Now, we take great pride in the dementia care that we provide. We have a program called Dementia Wise, which I'll talk about a little bit later. But as much pride as I take, when I sit down with those families, when I have these conversations, I always see that there's so much more we can do for them. There's so much more I can do for them than just be there and have a caregiver there. Not that we don't do enough, but just and then that brings me to my point is that I'm always looking out in the community. Okay, what more we can do? Who can I collaborate with? Who can we partner up with to bring more resources out to people who are in need? And recently we have partnered up with Brigade Health, and now I'm gonna introduce Brian. He is VP with Brigade Health. He's gonna take over from now and talk to you guys about the Medicare Guide program. So all you, Brian.
Perfect. Thank you, Nav, and thank you everyone for having me. Really thrilled to be here. Like Nav mentioned, I lead our partnerships here at Brigade Health. I am based in Atlanta, so thank you for letting me join you out in Modesto. But our company is a California company, so we are in 30 states now, but California is very much home. So and where we do most of our work. So excited to tell you more about the program. Guide is CMS's latest innovation program, which is exciting. And also I guess I'll share some news that came out yesterday as CMS made some initial cuts to different programs. We were thrilled that Guide is continuing. So I hope that gives everyone a little bit of assurance that this program will last. But again, thanks everyone for having me, and I'm excited to tell you more about the program. I'll dive right in. We'll definitely have time for questions at the end, and the more questions, the better. So it sounds like it's a full room. So really excited for having me. But for some context, and Nav alluded to this a little bit with her mission and her work, but dementia is one of the number one most, I guess, quickly growing diagnoses out there. As folks are living longer and longer, the number of patients or seniors over 85 with some form of dementia is up to 30%. With the number of kind of people hitting Medicare and the I guess silver tsunami, as they say, that projects to trillions of dollars of additional spending. I think this chart on the right really shows what that looks like for folks over 85. Growing a little bit more slowly in other groups as well, but I think that over 85 group really kind of highlights the issue, and that's certainly who we mostly serve as Brigade. The map on the left just shows this is a nationwide issue. Everywhere that seniors live and everywhere that people live, there's a rising rate of folks with dementia. So I think that's what inspired CMS to launch this program, or I know it's what inspired CMS to launch this program. Also interesting as we think about where this kind of came from, there were academic studies. So UCSF ran one, not too far from y'all, and UCLA also did one with a very similar model that proved results, and that kind of gets into this of having an impact. But what we have seen, and again, this is where CMS is coming from, dementia is just a really tough disease. It's a tough disease, and it is not ideally cared for by our current healthcare system. Individuals don't know how to navigate. They don't have all the support that they need to be effective in their jobs, or not even jobs. It's an unpaid full-time job that kind of goes along with this. Primary care doctors are often not exactly prepared to care for or support or even diagnose dementia. Another thing we've seen is that up to 50% of patients with some form of dementia or Alzheimer's don't have a formal diagnosis because the family conversation is tough, or because their primary care doctor just doesn't want to deal with it, or kind of get into the weeds of all that comes with it. So that is tough. Neurologists, I'm sure you see this in your area. I certainly see it in Atlanta and really everywhere that we work. There's just a huge shortage of them. If you can get in at 6 months, they're not ideally positioned to kind of quarterback or really make a patient's care plan when they're only seeing them that rarely, or have resources to support. And then last but not least, there's really no therapeutic options. There are a few new drugs out there that are somewhat positive, but definitely early days. So nothing, no silver bullets, nothing totally curative. And those drugs are also hugely expensive. So the most effective things that we have seen and that studies have shown are more time with individual support, more socialization, and more access to different opportunities that kind of provide stimulation. So that's what this program is trying to solve. We're really excited that we have been accepted into CMS as one of only 87 or so programs to offer the guide. So that's really exciting. There are more launching this year. So we were lucky to be on the established track. We have a history of caring for dementia. We've been doing this for almost 11 years now, more than 11 years, I guess, now that it's 2025. So have a history of doing this. The program officially launched last July. So we've been at this now for 6 or 7 months. Also really excited that we are the largest guide program in the country. So there's maybe 5,000 or so total patients currently enrolled. We have about 2,500 of them, which is great. And the vast majority of those are in California. So that's really exciting. A little bit about GUIDE. So GUIDE stands for Guiding and Improved Dementia Care Experience. So CMS was pretty literal with their acronym here. But just some facts about the program. It is 8 years. So from last July, it will run through 2032, which is great. It gives us a lot of runway to figure this out and also support patients. The goal of the program is really trying to catch patients early on. So as soon as they have mild cognitive impairment, let's enroll them in the GUIDE program. And CMS is really interested in monitoring how a program like this can kind of delay the progression of dementia and also keep patients in their home longer, keep them out of the ERs and all of that. So really improving quality of life across the board. One of the other great things about the program, so there is a caregiver assessment, which we'll get into, and that's kind of how we're partnering with ComeForCare locally. But the program itself does allow for virtual assessments. So our team is in Orange County, in LA, and San Diego. We're also in the Bay Area and Sacramento. We don't have boots on the ground presence in Modesto yet, but we do have, I guess, adjacent communities covered. And then, of course, as we grow, we'd love to be local as well. But the great thing about the program is it provides a total kind of telehealth waiver. So all of our providers can see any patients that need support, maybe beyond whatever the normal telehealth rules might be, which is great and gives us access to patients that might not otherwise have access to a geriatrician or someone trained in caring for these diseases. The way the program works payment-wise is we get a straightforward per beneficiary per month payment. So you don't have to worry about billing. It is always $0 out of pocket for the patient, which is maybe the most exciting thing. There's no copay. We don't have to worry about billing or any kind of those specific codes or procedures or anything that can be just kind of no fun to deal with for anyone at all. So makes things really easy and really, I think, incentivizes the right initiatives. Other thing to call out, this is not a value-based care program. It is not an ACO. It is not Medicare Advantage. So we are not trying to deprive services at all. There's no utilization management. This is all additional benefit that CMS really believes can drive additional impact. The other thing that's really exciting about the program, go back real quick. Other thing that's really exciting about the program is probably 80 to 90% of it is really dedicated to families, caregivers, neighbors. Takes a really big, a broad definition, I would say, of what exactly a caregiver is. So anyone providing support for a senior, this program is designed to address them. So patients keep their PCP. They don't have to change anything. They keep their specialists. So all their caregivers stay the same. What the program does is really connect families and anyone, kind of in that role to additional benefits. So there's paid for respite services. That's what kind of we're working with NAV on. Other support services like support groups, educational webinars, 24/7 hotline. We'll get into all the details, but there's a pretty rich set of things that are all for loved ones kind of struggling or forced into a role of support. And then we talked about this. CMS is kind of tracking some performance metrics, but the idea is to improve quality of life and reduce caregiver burden. And then the only tricky thing is you must work with an approved entity. So we're lucky enough to be one of those and happy to share our model with you. And there are other ones out there, and we can certainly talk about those too. Our biggest, I think, priority is just making sure patients get the care they need. Great, thank you. So this is what the actual guide model is. So a little bit of an ugly slide, or at least a busy slide, but this is I'm taken from CMS. So these are kind of the nine pillars of the program, if you will. So I'll step through them briefly just so you get a sense of what patients and families get when they do sign up for GUIDE. So I'll start on the top left and then go kind of counterclockwise. Number one is the comprehensive assessment. So this is how patients are aligned to the program. The program is totally voluntary, also does not depend on PCP alignment. So at some point this year, everyone that CMS has, that Medicare has on their record as having some form of dementia, will get a letter informing them of the program and listing local groups that are authorized to serve their area. So we'll be one of those. And then we kind of have to try to make contact with families to educate them and try to align patients. But the next step from there is a comprehensive assessment. And this is really a three-part thing. So the first part is a patient assessment. We kind of just take a snapshot of where they are with their dementia, and we have to reassess them every year. So that's an annual process. Takes about 20 minutes. It's pretty light. We have to do a functional assessment staging tool. It's called a FAST test. And we have to do a mini cog along with some other basic information, but pretty basic, does not take too long. We can do that via telehealth or with one of our local partners. We also have to do a caregiver assessment. So that's done with the Zaret Burden interview. Again, a 20-minute process. We can do it over the phone. It's pretty easy. Really just intended to determine, exactly what that caregiver's needs are. And again, we have to do that every year. And then last, a home safety assessment, which is not always required, but sometimes we're working with NAV to cover those. But the program wants us to go into patients' homes, make sure it's a safe place, and there's even budget or process to potentially make changes. So if they need a grab bar, that kind of thing, the program covers it, which is exciting. So that's the upfront part. That's the kind of comprehensive assessment. Coming out of that, we will create a care plan. So we'll create a kind of specific care plan based on their goals and their needs. We'll update that on an ongoing basis, but we'll also coordinate with whoever that patient's actual provider is to make sure that they have input and visibility. But there's just a great, I think, forcing mechanism to make sure everyone has one of those on file. Program also requires us to deliver 24/7 access. So our team of care navigators, nurses and nurse assistants are available around the clock. So folks can call in at any time if there's a behavioral outburst, if they have questions, really anything, all of the above. The 24/7 access is really intended for those uncomfortable situations that arise at 3 in the morning. And rather than calling 911 or community support, you can call us. Our team is really trained on how to de-escalate those and manage any situations that might come up. So that is always available. The next three, and I'm going to loop these together, ongoing monitoring and support, care coordination and transition, and referral and support coordination. All three of those are provided by our care navigators. So we have a team of care navigators. They're the same folks that staff the 24/7 access. They just take turns on who's available around the clock. There's another team that's available, or an expanded team that's available during the day. So one of the great things about the program, and all of this is kind of one because it's one role, but ongoing monitoring and support, depending on severity of the patient's dementia, patients will get regular touch points from our team. So if they have severe dementia, that is biweekly. If it's mild dementia, it is monthly. And then if it's moderate, it's somewhere in the middle of that, I think weekly. But regular touch points, just making sure that we're checking in, monitoring the condition as it moves along, and checking from there. Care coordination and transition, our team also helps with doctor's appointments, making sure they are going to their neurologist, helping them get in, book visits, making sure they see their PCP, even booking transportation potentially. They're just monitoring and being there to kind of help play quarterback, help solve any administrative issues, which can be hugely tiresome. And I think we all know how difficult the healthcare system can be to navigate. So the team is there to help with that. And then last but not least, jumping up to the top, referral and support coordination. Also making local referrals to community organizations. So based on what I know about this group, I think some of you we'd love to add you to our dictionary, but helping with community services, any support groups you all run would also be helpful. Meals on Wheels, anything like that, our team can also help with. And as we start supporting patients in a new geography, we want to make sure we have a really good Rolodex of all those local services so we can connect. Some of the biggest selling points, and I'll get into this too, caregiver support. So we have to host our own support groups, which is great. We also post educational webinars. We have a family patient-facing website with different tools, different resources, really intended to be a one-stop shop for how to support a loved one with a cognitive impairment. So that is great. And then the biggest selling point, and this is kind of how we're working with NAV, the program comes with paid for in-home respite services. So eligible beneficiaries receive $2,500 of respite services that they can use totally at their discretion. So this is good for in-home care. It can be used in an adult day center as well. So if you know a local one of those, we would love to work with them too. But the thing that I love the most about this is that it is at the family's discretion. So They can use this to go on vacation. They can use it just to take a day off. They can use it in little increments to go on, just take care of errands, go to doctor's appointments, do what they need to do to live their lives. But that is just a benefit that is, I don't want to say it's cash in the pocket, and $2,500 will not last forever, but it is more than was available yesterday and can really make a difference in just supporting caregivers and kind of giving them a break, and also helping stretch budgets. And then last but not least, med management, just to finish up on the last slide. One of the soft goals of the program, this is not required, but our team, we have a polypharmacy team in-house that will review all of the medications that a patient is on, just to make sure that there's no duplication, that we're being as efficient as we can, and maybe better managing side effects and also helping stretch budgets there. Last thing I'll call out, I noticed a few of these bullets were duplicates. So as follow-up, I'll make sure that you get the correct slide as well. Great, thank you. So who's eligible? So this is always the tricky part of who is eligible for GUIDE. So first thing, you have to have one of the qualifying dementia diagnoses. So this is done with an ICD-10 code that they will have on file. There are 80 that are eligible, so a pretty broad list, really everything that is kind of under the dementia and Alzheimer's umbrella. Only thing to call out, Parkinson's is not included. We get that question a good bit. And mild cognitive impairment is not specifically included, but we definitely want to work with you to help identify those patients. We still recommend doing screenings, and there's a non-zero group that does find their way into the program. So that's the first step. Second step, and this is the big one, you do have to have traditional Medicare Part A and B. So no Medicare Advantage, unfortunately, but any traditional Medicare is good to go. And hopefully will expand to Medicare Advantage sooner than later. Our team is working on that as we speak. So this is one in the middle, a little bit tricky just because we have to get into the weeds of definitions, but not residing in a long-term nursing home. So what this means is you can't be in a skilled nursing facility or a full-time long-term nursing center for more than 100 days. General senior assisted living, senior communities, memory care are all fine. This is kind of specifically a skilled nursing, more than 100-day stay. If you transition to hospice, you will be unenrolled from the GUIDE program. If you were to ever leave hospice, you could be re-enrolled. I guess same with the nursing home. If you were there for 110 days, you would be disenrolled. But if you were to go back to the home or to a senior living community, you could re-enroll in GUIDE. So you can always go back. And then last but not least, I'm not sure if there is one locally, but I know there are quite a few in California. You also cannot be in a PACE program, just because PACE services somewhat overlap with some of the benefits of GUIDE. And we talked about the voluntary alignment process. I love it because no one's forced into anything, unlike many other Medicare programs. But during the process, we'd get a referral, and then we would kind of conduct outreach, talk to the patient, talk to their family, make sure they're aligned, and kind of get their verbal blessing to join. So also no need to sign anything. Great. So this slide is just really helpful. It's maybe an easy way to draw out what this program looks like in practice for patients and their family members that are kind of going through it. So this situation deals with a patient, Mary. She's 85 years old, has severe dementia, lives with her daughter, Linda, who provides around-the-clock care. Mary's had multiple readmissions and behavioral outbursts, so really a prime candidate for this program and can really benefit from it. So we would get a referral to Mary from some form or fashion. So we would begin with that geriatric assessment I mentioned earlier. We conduct that assessment. It'll take a few phone calls. We'll have to work with the daughter, Linda, pretty closely to conduct those. But that's the upfront step. Should also call out that the actual alignment process takes about a month. So our task, the brigade task part of this kind of takes a week. So just to collect our information and package that up, kind of build an application. We submit that to CMS. The CMS process then, of course, takes a little bit longer, but still 2 to 3 weeks. So the overall process is right about a month from assessment to official alignment in GUIDE, which is always helpful just to set expectations on. But once the patient is aligned, our team will call Mary and Linda. They'll also get an official letter from Medicare confirming their enrollment. And our care navigation team will conduct introductory outreach. We also we really specifically do keep specific care navigators on specific cases. So whoever is assigned to Mary and Linda will continue to be that person, and that kind of helps build a relationship, some continuity, so they know who they're talking to. So that kind of officially kicks off the guide program. If they need one, we'll also conduct a home safety evaluation. So we'll send NAV's team in. They will do a home safety eval. We'll make sure that the home is safe. We'll address any issues that we find there. That can even be fixing a broken window. I've used that anecdote a few times, but we did run into that case where a branch had fallen and caused some damage, and we can kind of connect folks to resources to get that fixed, which is great. In the course of our care navigation team's kind of ongoing touch points and outreaches to Mary and Linda, we'll develop that care plan. We'll share it with their PCP for input, make sure we're not conflicting with anything. We want to make sure their PCP is also aligned. So if they want to change anything, that is totally up to their discretion. We'll also kind of include recommendations for pharmacy review and connections to community-based resources, like I mentioned, which can be really helpful. Respite coordination. So in the course of our kind of also care navigation outreaches, if Linda, the daughter, were ever to decide that she needed a weekend off, or, I need 4 hours on Friday to go run my own errands, she would simply call our team, let us know that that she would like to do that. NAV is our local partner for this, so we would confirm that with NAV's ComeForCare office. She would send someone in, and that's all paid for, at least up to $2,500 at a set rate as well. So that's hugely beneficial and no more money out of the family's pocket. Like I mentioned, with the care navigation, the family will continue to have regular contact with our team. We provide advice, ability to escalate issues as needed. We monitor things over time. So we really are interested in how the disease is progressing, how Mary's doing, and try to escalate anything that needs to be escalated, whether that's to a primary care doc or to a specialist to address those issues. And then if Linda ever wants to or needs additional support, I mentioned we have these support groups. So, at this point, just as an example, Linda would enroll in our support group, connect her to other seniors across the state or other family members across the state that are interested or kind of in a similar place. So just a place to kind of share stories, share learnings. Our team is kind of trained in coaching, but more than anything, that's to find a community kind of like this one that you can network with and try to learn from. And then the great thing is this program lasts for 8 years. So ongoing support, we will be around supporting Mary as long as she is interested in working with us and able to remain eligible for the program. Awesome. So just a little bit about us, and I maybe should have mentioned some of these things up front, but we dove right in. So I should call out that Brigade is a primary care doctor's practice. So we've been kind of doing different forms of care for seniors since 2013. We are not clinic-based. Our team is entirely mobile. So across the state, we probably have 80 different providers. Right about that. And that is a mix of actual MDs, DOs, and the majority of the team is APPs. I guess nurse practitioners and PAs. But those folks are all mobile. They visit patients in their home. They go to senior living communities. They connect with patients where there are. Over time, though, that team has served and cared for over 10,000 dementia patients. So we think we've figured this out as well as anyone can. There's always learning and changes, but we are recognized, I should say, as an expert in the field. And we've developed this comprehensive care model that not only champions the needs of the dementia population, but I think, just to tie this to this program, their families as well, which I think can make a huge difference. Like I mentioned too, there are other groups like us that are working in Guide. I'm happy to kind of share their names too, if you find them. We obviously, I'm biased, but I think we're great. But like I mentioned earlier, we really want to make sure that just every eligible patient is connected to one program or another, because I think these benefits can be really beneficial. And then locally, Nav can be your point of contact, so she can conduct any referrals or anyone that you think is a good fit. So you can kind of continue to work through her. I'll also make sure that she shares my contact info in case you want to reach out with any questions. The program details we talked about, so I won't bore you with those, and the keys to succeed are really more for a physician group practice. So I will skip those two so we can get to Nav's bit and make sure we have time for questions at the end. But thank you everyone for your interest, and I hope this was helpful.
Thank you, Brian. Thank you so much for this information. I hope he answered some of the questions, but we will have some time in the end. How does it work? give us a call. The phone number's on the flyers. We'll walk through the process. I know Brian had shared, and he's expert on this topic. I wanted to take this opportunity to bring him out, and bring what they are doing to the community, and get the conversation started, get the information out there. The next I have is I do want to take a little pause at this slide. So family members caring for a loved one with dementia shouldn't do it alone. Shout out to husband, wives, adult children who are now responsible or have to step into this caregiving role, which they were not trained for, they were not ready for, they did not know where did it come from, has absolutely zero to no knowledge. It's very easy for us in the room to nod heads at some of these things because we know, we've heard word dementia a lot, but most of the population out there, they haven't. I will give you guys a little example. I don't know how much time we have, but when I started doing this, Joyce mentioned I have 10 plus years of nursing experience. I have a bachelor's degree. I can't even count the number of times I've done CPR, ran Code Blue, have been part of rapid response teams, So when I looked into caregiving and all that goes with it, the terms that were popping up were dementia, dementia care, dementia focused. So in my head as a nurse before all this, I'm thinking dementia, it's a disease. Okay, I can talk about this. Let's take a meeting, let's start. I can do this, So I took my first meeting with the first client call that came through, husband and a wife. I'm in their living room. I'm thinking in my head with the experience that I have, the education I have, that I should be able to hold this conversation, bring it on. And I'm in that living room. I'm just constantly getting distracted with red eyes, like bloodshot red eyes. This husband, his eyes are so red. And the nurse in me is like, does he have an infection? Is he an alcoholic? Why are these eyes so red? I just can't, I'm not even listening to what he has to say because I'm so distracted. I'm stuck at his eyes, right? And then as the time, I was there for a couple of hours because the initial assessment does take that long. I realized, you guys, that he was tired. He was just tired. He hadn't slept. He was under stress. He didn't know what to do. He was lost. And here I was in his living room, and he was expecting me to give him an answer or provide a solution, which I could in form of a caregiver. And I still today I don't know how he signed me on because I was absolutely clueless, or I thought so. I went in my car and I sat in my car for good 5 to 10 minutes, I want to say maybe longer, just try to process and be like, what is this? What did I just walk into? Thinking I know this, I'm a nurse, I got this. No, I don't, and that kind of was a wake-up call for me that if I am going to say that, oh, we provide quality dementia care, what's the work that I'm putting in? What am I doing? What are we doing to make sure our team is ready? We have enough resources with this family, Sometimes we're in their home for 4 hours. These people are doing it for 24/7. Who am I to tell them do it this way or that in that 4 hours, They don't even see me all the time. So it's heartbreaking, but I shout out to people who do this, that just get thrown into this situation, and I have repeatedly seen it that family members, they're so people who are going through dementia or memory issues, they're so mean to their loved one, you guys. They're so mean. It's heartbreaking to see. This husband has loved this wife for 50 something years, and over here she's like, I want to go home, and he's like, what home is this? This is home. We raised our kids here. But we all know, we've all heard it. I want to go home. I want to go home. And the families go crazy because they hear it all the time. They hear it while they're changing them. They hear it while they're trying to bathe them. I sat back and I thought about it. I was like, so far, the patients that I've taken care of with multiple diagnoses or whatsoever it was, it was different because there was physical work, there were nursing skills required and all that. And the families, yes, if they're taking of somebody, they're taking care of for some time, But with dementia, the disease is progressing. There is not enough support out there. There's not enough answers out there. This person is having sundowner at 11 o'clock, 10 o'clock in the night. PCP is not open at that time. Like this family is just like, where do we go? Like somebody's telling them, go get the diagnosis. They're like, should we? I don't know. Who do I talk to? It's crazy. And it's the emotional too. Like, seeing the person you've lived with for so long, or your mom who raised you, or your dad who was the strong personality your entire life, seeing them decline and right in front of your eyes, and just being like, and they don't even know who you are anymore. It's just that emotional toll every single day. So I can talk for this, but anyways, so that's kind of what brings me to programs I guide, and I'm so thankful, and I know that maybe the amount that they're giving, the hours that they're providing is not enough, but it is a start. It's definitely a start. We all need to look at the positive, and it is a CMS program. So if they see the need, if they see that readmission and the hospitalization is getting prevented, it will reach theirs, because they don't want to pay. Nobody wants to pay $1,000 for the hospital bed. They really want to keep people home. And this disease, the numbers are getting higher every day. So programs like this are so needed in our community. Next I have is, Brian kind of talked about it, it's provided by us. I do quickly want to mention, so the in-home respite services that will be provided by our caregivers go through training called Dementia Wise. Dementia Wise is a program with ComeForCare. We have this program. We train our caregivers and our team members who are interested in this. We get them certified in it. And also the resources under this program, Dementia Wise, is available to our families, our team members, the patients themselves. I learned so much from it. I just told you guys, I was all proud and high, like thinking, like, when I started this, that as a nurse, I understand. I learned from this program because throughout my education of years and years, my university degree or whatsoever, I think I received 1 hour of class on dementia. And now that I think about it, when I was a bedside nurse or when I was a triage nurse, I just go back and think like, oh my gosh, like I could have done things so different if only I knew how to communicate with them. We are burned out in the hospitals. I'm not gonna lie. We have, as a triage nurse, there was a line outside my door. I could have spent more time. And it's very easy for us to label patients difficult patients. We're like, oh, they're just difficult. Like they're not complying. Like we don't know what to do. So I do feel bad, but I'm trying to learn. I'm trying to grow. That's why I'm here. So yeah, if you guys have any question about our program, I should share this. Our program, Dementia Wise, is validated. I mean, it is on the Alzheimer's Association website. So right here, so they have recognized our program. Duke University has done study, and it's been validated by Duke University, the program that we have in place. And last year, towards the end, our corporate office came up with a second version of this program. So now it's divided into 2 parts. That just means that it has more information, and we're still, I mean, even today, a back office, and we all are, I'm part of this too. We're coming up with new techniques, how we can help them. It's very caregiving focused. When I took this class, like it's focused on, you're in this, how do you navigate that situation? So I definitely see the value in it. So yeah, so with the guide program, I think Brian had mentioned, contact us if you have any questions. I do want to mention one thing in here. If I am with a family member who really absolutely needs it, I would start my conversation with, there is this program that you can benefit from, but it does take up to 8 weeks for you to receive the respite services in your home. I think it's you don't want to get somebody's hopes up too high. When they're sitting in front of you, they're just raw. Like, they want information. They're taking everything you're saying. So I would start my conversation with like, hey, there is a program, but it does take up to 8 weeks. So they're ready. And 8 weeks is nothing. Like I have seen people, families just coming to a decision, and it takes like months, it's just like one sibling's out of state, just getting everybody, on board that what is going on here. So 8 weeks is not that long. They can get the process started and start having those meetings around with what the next steps should be. Yeah, so this is kind of like, and brings us to the end, guide summary and FAQs. I do want to just read on this, that how can we work together? So ComeForCare can accept patient referrals, and with Brigade's partnership model, it allows for like pretty much all of you guys in this room, you know, to become an extension of this model. Like, I really hope you guys take this information out and share or read on it, you know. I will be taking your email and sharing educational flyers on this topic. So even if you don't have time today, you can always just kind of look back and see, oh, what was this program? It's here to stay. It's here for 8 years. That's a long time. And again, like as Brian mentioned, there's nothing else out there. So we'll take whatever CMS or anybody's giving us at this point. So we will open it up for questions now. Hopefully Brian can answer them all. Go ahead. So if you know of someone, I know it's a lot of information, have them give us a call, you know, and we will share information, the next steps with you, just to make it all easy. And yeah. Oh, that is for Brian. So I know we're, as ComeForCare, we're kind of the representatives and taking this on it here in our county. And I mean, yeah, so, and Brian can answer that question.
So I can't hear the room that well, Nav. So if you can repeat the questions, that would be super helpful.
So Amy asked geographical area that you guys cover?
Everywhere in California. So nowhere in California is out of scope.
Other states?
Other states, we are in right about 18 states. So we are in Oregon, Nevada, Arizona, Texas, Colorado, Utah, Florida, Georgia, Tennessee, Ohio, Pennsylvania, Illinois, and New Jersey, and more on the way.
Around for 8 years. Yeah. Why is there a limit on time? Brian, why is it only around for 8 years?
Yeah, so great question. So this came out of, and this is getting into some, I guess, government specifics. Guide is with the CMS Innovation Department. So it's what's called a demonstration project. So our thought, usually these demonstration projects are to collect data and prove whether this is effective. So after the 8 years are up, there will either be a guide version 2, or it might become a formal program. So it just gives the government a chance to test a hypothesis and then make changes before they make it official forever.
When I was in nursing program, I used to run after school care program. And this was in a different country though, Australia. And towards the end of the year, my directors and managers would always tell me that, like, Nav, did you guys use all the funding? Like, have you guys used all the funding that was given to you? And I didn't understand in the beginning because I was maybe 19 or 20. I was like, why are they so fixated on the funding? Because in my head, I'm like, but I'm saving this money. Like, look how much I've saved over the year for this after school care program. They're like, no, you need to spend. If you don't spend, if you don't use it, if you don't show there's need for it, you will not. And I'm not saying it applies, but it kind of, in my head, in a way, like, I'm thinking it does apply here. If the government sees in like these 8 years that, okay, this is working, you know, we're getting the results, and I'm pretty sure that they will keep it going, you know. So, and that is the hope. Fingers crossed.
And our hope is they grow it and make it, expand it to Medicare Advantage and increase the hours of respite, and, just kind of use this as a pilot more than anything else.
Yes, Bob.
What's the best number to reach you at?
Oh, best number, it's on the flyer. And then I will text you too. Any other questions, you guys? No? Well, thank you so much again. I mean, I'll let Joyce.
Thank you, everyone, for having me. It was great to be here.
Thank you so much. Thank you, guys.
Yes, thank you so much to Nav and Brian. And when you were sharing that story, it just reminded me of the powerful work that we do, that comes out of this room. We can talk about clinical and data and information, all day long, but at the end of the day, these are people's lives and they're being impacted, and it's difficult and it's hard. And so, just reminds us why what we do is so important. So I love that. Thank you for sharing that with us. Okay, so our next meeting is going to be April 10th. We meet the second Thursday of every month, and we will be hearing from, let me get my glasses on, Golden Age Home Care founder Marinella Placentar. Oh, I love it. She's ready. She's like, let's do it today. She will share with us about residential home care for the elderly, Golden Age's vertical system of in-home care, and partnership opportunities with other providers. So mark your calendars and let's fill the room again to support her. I love that. So let's finish up our meeting with some great raffle prizes. And while we're getting the little box shook up, as always, thank you so much to Jan and Serpa from Community Hospice for hosting us. I was just looking around the room today and I was like, how far we've come. Okay, well, let me announce who the first gift is here. So this is a bottle of wine, Pinot Grigio, my personal favorite, from the park at Modesto. So let's see who's going to win this. Patricia Mendoza, aka Patty. All right, perfect. We have a Stuart and Jasper basket from Stephanie from Stratford Place. Okay, thank you so much. Thank you, everybody, for all the wonderful raffle gifts that you bring to support our group. It's so appreciated. This is going to go out to Jennifer Weber. All right, we have a little shamrock gift up here. Oh, look at the little socks. They're so cute. From Mary Keaton from Peace of Mind. Oops. Party foul. All right. This is going to William Flores. It is your lucky day. So many great gifts today. All right, this is donated to us by Miss Tammy Mason with a touch of love. We love Tammy. This is going to Teresa Pettipiece. Oh, this is so cute. The little towels. We have a name here. So this is from Rav, right? Yep, perfect. All right. Shake it up good. I'm trying to get that. Lisa Clausen. Ah, so good. All right. Wonderful. Thank you so much, everybody. Don't forget to check out the table. Thank you for a great meeting today.